we've seen you all, and we want to just welcome you to our last rec for Agency with Choice OERs. I'm not sure if everyone knows me, but I want to introduce myself. My name is Andrea Poe. I'm the Operational Policy Analyst with Agency with Choice under the ODHS, and I will pass it to Jason.
Hey, good afternoon, everyone. Thank you for being here. We're really glad to have you join us today. My name is Jason Pruitt. I'm the APD Agency with Choice Program Manager, and I use he, him pronouns. Thank you.
And I'll introduce myself really fast. My name is Jenny Newhouse, and I'm the project manager for Agency with Choice, and I look forward to this afternoon.
Thank you, team. We want to start off with the community agreements. So our community agreements are participate and be present to the best of your ability. Understand that we're all collectively learning and growing. Create a safe space to allow for dialogue about our work. Strive to have inquiry over judgment and assume positive intent. Be respectful with your words and communication. Communicate in a way that works for you. Invite laughter, compassion, and gratitude into conversations. Acknowledge it's not agreement. Understand that some things may feel unresolved, and make sure to take care of our minds and bodies. Thank you, Jenny. We want to start off, we want to take a moment to be able to provide clarity around the direction of the licensing process. After a thoughtful review and consideration, Oregon Department of Human Services will not be pursuing joint licensure with Oregon Housing Authority. It's just important that each program reflects the unique needs and structures of the individual's need serves. Excuse me. As we worked through the OERs and incorporated the valuable feedback and comments received, we wanted to ensure the OERs establish a self-directed service delivery model for older adults and individuals with physical disabilities. We deeply appreciate the insight and engagement from each of you throughout this process. Your feedback has been essential. We do recognize this, and we want to reaffirm that the intent of the Agency with Choice program is to empower individuals to direct their own care. And with that, we want to thank you all for your continued partnership and commitment to this work. We also wanted to be able to brief you on the changes that has happened in the OERs between the last RAC and this RAC. The revised rules prioritize individual autonomy, ensuring that services are person-centered and responsive to the unique needs of each individual. All redundant and overlapping rules were removed or consolidated to simplify the regulations, making them more accessible and easier to navigate. The current version of the OERs are specifically tailored to the Agency with Choice model. They provide detailed guidance on the roles and responsibilities of agencies and individuals, focusing on the person-centered care and self-direction. Excuse me. All references to Oregon Health Authority were removed to align the rules strictly under ODHS and aging and people with disability. Standards for initial licensures were combined with the application for licensure. Formal sections provided enrollment was removed and some language was added under reporting and billing requirements. Sections that were added or renamed were response to grievance and critical incidents, administrator qualifications and requirements, direct support worker qualifications and requirements, agency records, and program review and investigation. Formal sections direct support worker qualification and requirements became individual choice to receive agency with choice services. Formal sections planned became delivery of services. Formal inspections and investigations, variance, and, and information was added under the program review and investigation section. The following sections were the sections that were removed: medication services, infection control, and nursing services. Medication services was removed because medication services are part of the ADLs and IADLs, and they are part of training that the direct support worker must obtain. Agency with Choice directs the support workers' duties, and we want to make sure this program is self-directed by the individual or representative. We are requiring direct support workers to have training on medication safety. Infection control was removed, but added to the section direct support worker training requirements and quality assurance performance improvement. We are requesting for the Agency with Choice to provide their training curriculum, with infection control being part of those trainings. Part of their quality assurance method is identifying, analyzing, and correct critical incidents. Issues with infection control and other aspects of performance related to the services provided. Nursing services was removed because in the House Bill 4129, it mandates that the department must provide the nursing services. It would create confusion to the Agency with Choice if this section remained, and that is the reason why it was removed. We wanted to provide just the overview of all the changes that occurred, and with that being said, we'll go ahead and get started with the current OARs. Jenny, can you thank you. Since we're really tight on timeline or the time right now, we're just going to go section by section to see if you guys have any comments. We also provided a summary of each section to help with your understanding and review of these current OARs. First section is purpose 411-039-0000. If anyone has any comments or feedback, and we do ask if you have written feedback, if you can please email that to us, and we'll provide the generic email here in a minute. Can we ask everyone to mute as well? We'll go on to the definitions. 411-039-0010 definitions. If anyone has any feedback or comments.
Good afternoon, Allison Lee. There were several places in the definitions in which, and we'll provide written comment, but in which the definitions no longer matched the overall package. Additionally, I think we would ask that the definitions of case manager and service plan be added.
Perfect. Thank you for that feedback. Eugenia?
Yes. Hi, Andrew. This is Eugenia with the Oregon Healthcare Association. If we're going section by section, I'll just kind of highlight a couple of things that I picked up on. I think there's a typo in subsection 4 around agency with choice, because it reads a little funky. So I'm thinking you guys might have meant to say like is licensed by the department to provide agency with choice services as outlined in this rule. If you guys are removing certain services like nursing services, it may be helpful to make clear in the definition of agency with choice services, the scope of those services. So if it doesn't include nursing services, to make clear it doesn't include nursing services. And then the question that I have around medication management and services is, Completely appreciate the need for individuals to self-direct, but I am a little concerned around maybe some overlap with OSBN and their rules around nurse delegation. For instance, if it's an injectable insulin, I don't know that they can do that type of medication service absent nurse delegation. So I do want to be mindful as we're kind of pulling out definitions that we're not tripping up with nurse delegation and what is required by OSBN.
Thank you so much for that feedback, Eugenia.
And then one last thing is I still have concerns around critical incident. That is a new term that is being introduced. I did, it sounds like that's coming out of the Medicaid access rules. It is a concept. I understand that these are rules for agency with choice, but it is a concept that could have implications for other licensed care settings that serve Medicaid consumers. And I don't think this is necessarily the right place to start implementing components of that rule without larger stakeholder conversations around critical incidents. Because that definition has also is broader than what's in the federal rules as well.
Thank you, Eugenia. In the red line that we provided, we also provided some comments or feedback into everyone's suggested feedback. So, Eugenia, if you have other stuff down the road or anything that you want to send to us via generic email, we can follow up on that. But thank you for your feedback. Rachel?
Yeah, similar to what Eugenia raised, I was going to ask about critical incident because it was flagged by us originally. We saw it again in here. I think we share similar concerns. And I guess my question is, why is the definition in here when there's no operational standards in the rule that relate to it?
Thank you. It is part of CMS. It's the changes that are happening, but we'll take that into consideration. Rachel. Bethan?
Yeah, thanks, Andrea. And I want to start by saying that this is substantially better, and we appreciate the time and effort you took to improve and make sure that it more accurately reflects an agency with choice program. I have several places in the definitions. I think that that's probably the area where we want to make sure that the definitions really align with the agency with choice program. In subsection 10 on backup plans, it should be that it would be an authorized representative to ensure uninterrupted services, because it's the individual or the individual's representative that develops their backup plan in an agency with choice model. And then in change of ownership in sub 12, there's a business context that I think needs to be addressed. We need to make sure that right now it says change of ownership means adding or removing one or more owners, or a change of more than 5%. That might lead to some unintended consequences. We would suggest one or more owners which constitute a change of more than 5%. And that way, without this change, the sale of a single shareholder's stock would trigger a complete relicensure process for agency with choice. And we don't think that was the intent of the rule. And so creating a revision to ensure that the rule aligns with industry standards would be important. Do you want me to keep going with my comments, or how would you like to handle it? Do you want to jump around if other people have questions, or?
I don't see any other hands up.
Okay.
If there's a few more, you're welcome to do it. If you have them written up, if you can send that over to us as well, and we'll take a look into it.
Okay. In subsection 16 on direct support worker, we think that you should be using the term service plan as the defined term. Right now, you have it in lowercase letters as individualized service plan, and we want to make sure that it's referenced to the defined term. And then it also on the direct support worker, because there's not much guidance in the enabling statute and these rules, we believe that the direct support worker job description should be minimally prescribed by the administrative rules. And then we have I will send this to you, but we have a proposed job description that we will include as well. And then let's see. I just want to make sure I'm hitting the ones that are most important to us. We do have quite a few. And then in 17B, the proposed language aligns with the operational conduct of the Agency with Choice program. But as proposed, this section would necessitate constant surveillance, which is financially not sustainable and would dramatically increase programmatic costs. So making it something more along the lines are made aware that they shall not manufacture, possess, sell, or trade. And then in subsection 19, we suggest changing the word grievance to complaint, because grievance is not one that is utilized within the administrative rules because of its unique connotations with the labor marketplace by Agency with Choice providers. The term's use in this context may confuse direct support workers, individuals, authorized representatives, and Agency with Choice and other interested parties. And we know that complaints should be recognized and documented, but not every complaint may necessitate department action. Conversely, we want to make sure that we aren't departing from the prescribed rule is more problematic and may require additional oversight by the department. And that way, so maybe creating a formal complaint definition might be useful. Let's see. In subsection 25, local office, we don't think that this term is referred to anywhere else in these rules. And so not sure why it's included. And then we see. Thank you for being patient with me. There's a lot of comments here that provided. I guess we added this subsection 35, we added a definition of service plan, and means the individualized service plan, which is prepared by the individual or the authorized representative with input provided by the case manager. And then we believe that defining the plan, including its preparation and contents, is a vital aspect of the rulemaking. And we also need a definition of case manager, but I think someone else said that. And I will include the rest of our comments in writing. We did have some others, but that kind of gives you the highlights of the things we were considering as we went through the rest of the definitions.
Thank you, Bethan. We really appreciate that, and everyone else that provided their feedback. With that being said, I don't see anyone else's hands up, so we're going to move into 411-039-0020, application for licensure, if anyone has any feedback or comments. Tina?
Yeah, sorry. I was trying not to interrupt the previous speaker, so I do want to go back to the definitions for just a minute. Let me get to my copy here. Okay. Well, I did have a question on sorry, I'm dealing with 2 or 3 different okay, let's see here. Okay, I'll just do mine and then I'll ask the question that was just brought up in my head. Okay, I think on I'm sorry, number 23, where it says legal representative, and then it would also go down, also apply to section 33. 23, I believe, says that the terms will be used interchangeably, and those are two definitely, I mean, they can be the same person, but normally they're not, in my experience as a longtime advocate. One is someone designated, given proper authority, actual legal authority, I'm sorry, by the court to make certain decisions, while the other person is chosen by an individual. And to me, I'm not sure if in these rules, I didn't search for every person, every time it mentions representative, but I think there's probably no doubt some places where they can't be interchangeable. I just don't think.
Thank you, Tina.
Sure. And then I'm sorry, the speaker right before me had mentioned something about because we're taking out quite a bit of specificity, or maybe all, about direct service worker job description. I'd like it if she would try to repeat for me what she said about, then we will be providing a specific job description for inclusion. I didn't know if she meant in the rules or in an application to be an agency with choice, or what does we mean, and what is a specific job description submitted if we're not going to have one in here. Does she mean in an application? And I can let her answer that before I forget, if she doesn't mind.
Yeah,
Beth?
thank you. This stuff is confusing to jump around in. We put it in, I'm just rolling down there. Hang on. We thought that we didn't include the entirety of a job description, but we thought it needed to go into the personnel record section, that there should be a job description included for a direct service worker under 0390130. And let's see, and we is Consumer Direct Care Network. That is who I represent, for clarity.
Thank you.
Yeah.
So I was trying to get down to where you were trying. It is very hard sometimes to go through this many pages. And what section? Oh, well, maybe when we get there, I can ask if I still have a question when we get to the place you just referenced. Because I also have a comment about what should go in the record held by the agency with choice about direct service workers. So I'm okay with going on, Andrea, if you are. Thank you very much.
No problem. And Beth, then I know you were just off mute, but we were on section. Jenny, can we go to the 411-039-0020 application for licensure? Beth, and I just wanted to make sure that if you had a comment or feedback on here.
Hang on, I gotta get back there. Oh,
no worries.
We just made the same change in sub 3D that we mentioned above about the change of ownership. So identification of any person, including owners and partners, with a financial interest representing more than 5% of ownership, to ensure that, one-off people leaving and things like that are not what cause a whole new relicensure. process. And we included that in the definition above of change of ownership that I mentioned.
Thank you.
And we will send
Anyone-
this to you in writing.
Thank you. We appreciate that. Anyone else? Eugenia?
Hey, Andrea, I just have a quick question. Is there still an intent to keep the concept of critical incident in here? And I want to go back to that only because if we need to talk about that definition, I think it's meant to allow the state to triage the different types of incidents for, again, quicker response times and things. And the way that it's phrased now, I don't think allows for that because it's talking about actual or alleged events that create a risk of harm, but I mean, anything can create a risk of harm, so to speak. So I want to go, I mean, if there's an intent to go back to keep the concept of critical incident in these rules, I do think they really would want further discussions around critical incidents and what that process looks like. But if there's an intent to take it out, then I don't know that there's a need for further discussion on that. So I just want to put that out there.
My understanding is that critical incident is changing in CMS. And Jason, please jump in if there's anything else that I'm missing. And so all services throughout APD and I believe OHA will change to critical incident. So that either way, if we go back to what we had in the first one, this is going to get amended to critical incident. We are really far out in the process that it might be potential that we would, no matter what, we would have to keep it, but it is changing in CMS. And is that we are keeping critical incident in its CMS regulation. And like I mentioned, it's going to be changing throughout OHA and APD all throughout the programs that we have. Bethan? Oh, sorry. Eugenia, I didn't see you go off mute, but if you have a comment or anything before.
We can share further written. Like I said, it's if we're defining that here and we're changing it across all settings, I remain concerned about setting that baseline standard here.
Perfect. Thank you. Bethan?
We think that on sub F, big A, that it would be important to remove the word unencumbered, because it doesn't accurately reflect the business marketplace, financial solvency and ability to meet the financial demands of the program are achieved by all of the provisions of this section. And to require an unencumbered line of credit is not required to ensure programmatic success and integrity, and could ultimately increase the cost of capital and therefore raise the cost of the program.
Thank you, Bethan. All right. I don't see anything else. Anyone else hands up. So we're going to move into section standards for license renewal 411-039-0030. Tina?
Sorry, day late and a dollar short. Yeah, in the section we were just in, under let's see, big F, little I, it talks about a signed labor peace agreement. And I just wondered, since we recently had, and I know this ruling was just about cannabis and it being, anyway, but my question is bigger than that, and that I've read quite a bit lately about the issue of the state's requirement to have this in either contract or licensure requirement. And since the district court did conclude just a few days ago, I believe anyway, that it was impermissible to condition a state license on an employer refraining from conduct protected by fair labor law. And I'm just wondering, is that something that we just need to leave in here till there's, I mean, if there's more, there may not be more clarification and there may not be the following suits that I've been reading about, but where that it will not just be some people will be using it as trying to set a precedent that you don't do this in any industry, that the state has no right to put that in any contract or make that a determinant of licensure. So I just want to mention that. I know rules change all the time.
And I can try to tackle that one for you, Tina. It's definitely something that I've been tracking and watching how that's been playing out, and I've flagged it for our DOJ partners. I think there's going to be more conversation internally with them about what that looks like for our rules. So I appreciate the feedback. And at this time, I don't have any more, insight into which direction we'll go with that, but we'll go with the direction that we're given our Department of Justice, if that makes sense.
It does. Thank you very much.
Thank you very much.
Thank you, Tina. Beth Ann?
Can I just ask Tina, what section were you referring to? Because I want to make sure I'm not being repetitive. I think we may share the same concern.
Let's see. It's
in the L. It's right before 4, the
Yeah,
signed labor peace agreement.
It's on
Are we
page
in-
it's on
11.
page 11.
Are we, what rule are we in right now?
We are in 41103900020.
00. Okay, sorry, I was ahead. Apologize.
No worries. Now we are in 41103900030 with standard for license renewal.
I do have comment.
Get Brad or Crackers already? Did you get Brad or Crackers?
Okay, Beth Ann?
Thank you, sorry.
No, you're good.
There's a lot of, I have comments all the way through it, so my page numbers aren't aligning to your page numbers. In sub 1, we would add the sentence at we would add a preliminary sentence to say the department shall issue a license renewal notice at least 120 days prior to taking any action on the status of an agency with choice license. And that way we're protecting both the licensure holder and the agency by requiring the agency to put the license holder on notice that the license is under review, either due to expiration date, a change in control, a suspension, or a revocation. And then in sub 2, we want to raise that this is a pretty old type of approach, and it may be in violation of the Worker Adjustment and Retraining Notification Act, which requires employers to provide a 60-day notice to employees, state and local representatives before a mass layoff. And then in sub 3, 60 days prior to renewal is too short of a timeline for any action taken against the license. While we believe it is possible for review to be conducted in less than 60 days, any actions taken against the license in that short period could negatively impact continuity of care. And then in sub 4, we're concerned that this rule is overly vague and would grant the department a loophole for that might result in interpretation issues. So we just want to bring that up, and we'll provide more, but that kind of covers the entire rule.
Thank you, Beth Ann. If anyone else doesn't have any questions, we'll move on to 411-039-0040 in regards to reporting and billing requirements. Beth Ann,
Sorry.
you're good.
Takes me a second to get everything. Sub 5C, the administrative rule is unclear as to who determines the approved hourly rate for services. We know it's complex, but we think it should be who or how the rate is calculated should be referenced in rulemaking. And then in sub C, we think we should delineate minimum insurance limits should be mandated by the administrative rules. And
Thank you, Beth
then,
Ann. Oh, sorry.
sorry, I got one more. One
No,
more
you're
here. Sub 8, the proposed administrative, this rule is, we think, is a bit vague. Oh, wait, did I already do that one? I think I already talked about that one. We think it's vague. We
Okay.
haven't gotten to this one yet. And it and might result in interpretation issues again.
Thank you. Patty, I see your hand up.
Good afternoon, everyone. Back under the requirements for the EVV situation, particularly under location, it doesn't specify the, and they're under D. It doesn't specify when the location is captured. In other words, this leaves the door open for providers to be tracked throughout their service time. I think that's very concerning.
Thank you, Patty. I don't see any more hands up, so we're going to move into section services provided for 110390050. Rachel?
Yeah, I had just marked a question around 4F, and I wanted, it says maintaining a safe workplace in self-direction and in the roles or responsibilities of the co-employer. And I don't know if, I just had a hard time understanding what that means.
I think the maintaining a safe workplace in regards to just I understand it's a bit broad, but the intent was like drug free, just making sure that no one gets hurt, and those are the things as well that we'll be looking into. Hello? Oh. But we can get back to you on that one. And if you have any other questions, submit it through email as well. But that was our intent into making sure that direct support workers are safe as well as consumers, especially like operating a machinery or like the Hoyer, things like that, that there should be a safe workplace. Beth Ann?
Thanks. In sub 3, we want to note that the term provider isn't defined by the statute or administrative rules. And we think we need some clarity about whether we're talking about the agency with choice provider or the direct support worker in this particular context.
Thank you.
Yep. And unfortunately, I'm not done yet, but in sub C, the use of the phrase proactively work conflates the role of agency with choice, agency in a self-direction program, providing individuals with appropriate paperwork and training on the backup plan as appropriate. Proactively work connotes an affirmative action by the agency with choice agency to prepare, draft, and finalize the backup plan. And that materially changes the role of agency with choice and could lead to a dramatic increase in costs. We also want to say that the phrase, let's see. And then we would raise the same the same concern with sub E. And we note the use of case manager, but we already discussed that needs a definition. And then sub 8, at least as the way it's written, this section runs counter to agency with choice co-employment model. We would suggest new language that says the licensee and the individual or the authorized representative are responsible for the blah, 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 blah. To make sure, because it is a self-directed program.
Thank you. Tina?
My comment has to do, at least for me and my background, with the self-directed model too. And mine was under, hope I'm in the right place, under services provided. Number 4, the agency with choice must assist the individual with the following responsibilities. Before I go to the responsibilities, I want to know who, and I know that we've taken a great deal out of here that is directive about how the agency with choice will work and that kind of thing. But anyway, I have concerns about who at the agency with choice will assist the individual with these recruitment and selection processes, because from the get-go of this whole process, have been very concerned about some of the duties listed for the quote direct services worker, or whatever we're calling this person. I'm always so confused anymore. Actually helping the participant, the individual, with things like recruitment and interviewing and hiring and those kind of things, because it could be the very person that's helping you, if it's a direct support worker, that wants the job that you're recruiting for. So I still have a huge problem with that not being spelled out, that there's a separation of duties for some of the services projected to be provided by an agency with choice. And then under A, it says recruiting. Okay, so you're going to help the individual with the following responsibilities. Now, the responsibility of the individual is going to be recruiting and selecting direct support workers employed by the agency with choice. I think that says that anyone that gets under this program or chooses to have this program as their program model has to then hire someone already within the employ of the agency with choice. And that was never my understanding. It was my understanding, yes, they would have people probably open to hire if you wanted to interview them, but that you could take your current service worker, or you could recruit on your own in the outside, have them go to the agency with choice and see if they, quote, meet their specifications for somebody they would hire. Thanks.
Thank you, Tina. Rachel?
Yeah, I had to find my unmute button. On the recruitment piece, so in the bill, it talks about a requirement for recruiting and retaining workers. I see the part about recruiting, but I missed the part about retaining. Is that somewhere in this section?
It should be some, maybe it should be a part of the OERs. I'm blanking out right now, but there is a section about retaining direct support workers, and I'm trying to find that as well. But once you send us your questions, Rachel, I can provide a bit more feedback into what sections and stuff like that.
Okay, sounds
But
good.
it
Thank
is,
you.
but they are within the OERs.
Thanks.
All right. So we'll go down to the next section, which is operational standards, which is 411-039-0060. If there's any questions or feedback. Bethan?
Me again. In sub 1, we would change the words. It says agency with choices, operations. We would change it to contractual obligations because agency with choice can only be responsible for those items properly within its contract or these administrative rules. There are limits that authority that are not reflected by the current draft. For instance, agency with choice is not responsible for Medicaid eligibility determination or redetermination, authorizing services or funding plans of care that are not reimbursable by the department. So we would urge just, ensuring that that is a contractual obligation. And then, let's see. And then I think that we have some questions around sub 3 that I want to raise. We have the second sentence in sub 3, we would suggest deleting it. We know that there is a huge shortage nationwide for direct support workers, and agency with choice is a model of self-direction. One of the best methods to alleviate the shortage is we have to acknowledge that there is a shortage writ large. And we want to make sure that, inclusion of this sentence may establish a standard that just simply can't be met given that dynamic. And I think we have some other comments in this section, but I will save those for just the written comments.
Thank you, Bethan. Eugenia?
Yeah, on subsection 5, it talks about an agency with choice being able to accompany an individual anywhere in the U.S. if requested by the individual. I presume that is subject to approval from the case manager, because I know agency with choice is not allowed to accept private pay. So I don't know if that's going to conflate those two worlds. And if it's, again, subject to case manager approval or, then we may want to add some clarity in that role.
Thank you. Okay, we'll move into the following section. Bethan?
Can I, one more that I want to just raise in 11E on the one we were just in. We would add a final sentence to sub E. The individual or authorized representative has a duty to supervise the direct support worker consistent with the plan of care and to attest to the accuracy of the EDV time submissions. As co-employer, the individual has a duty to supervise and needs to attest to make sure that the shifts are accurate. And the individual or the representative also has a duty to direct work consistent with the plan of care.
Thank you. All right, we are in the section background checks, 411-039-0070. And we'll give it a few minutes to see if anyone has any comments or feedback.
Oh.
Bethan?
Yes, sorry. Up, down, up, down. On sub 6, just a question. Does the department plan to reimburse for CBC's fingerprints and 2-year recertification?
So I know that with the in-home care agencies, I believe we pay for it. But right now, based on the language here, the agency with choice is responsible for that. And we're confirming. So there's still a few things that we are confirming on, but so far what we have, that's what it is. It states. Kelly?
Yeah, my name is Kelly Myrick. I'm the Operations and Policy Analyst for the Background Check Unit. Currently, we do background checks for home care workers and in-home care agencies that have a Medicaid contract. So if it's a private pay in-home care, we are not doing those background checks. Currently, we cover the costs of the background checks that are done. We do not cover the cost of the fingerprint capture if a fingerprint-based check is needed. They're not needed at all times.
Thank you, Kelly. Eugenia?
Just a question. The way it's phrased, is it just that the agency with choice has to submit the background check before the person can work, or does it have to be completed as well, submitted and completed? Because I know typically it's submission and completion of that background check to make sure it's clear.
I believe the intent is submitted and completed, and they will submit it to our background check unit. The agency with choice will. Rachel?
Yeah, just to keep talking about background checks. I mean, I think if the in-home care agencies do not have to pay for them, agency with choice should not have to pay for them. So that should just be reflected. It should be definitely no more than nothing more than what in-home care agencies currently do. And I think to Eugenia's question, my understanding is that in-home care agency rules do not have the clarity around completing it. It just says that you have to submit the background check. So again, just flagging that I would like us to not add any language that is not present in home care, or that is present in home care rules that doesn't need to be reflected here, if that makes sense.
Thank you, Rachel. All right. I don't see any other hands up, so we're going to go into the 411-039-0080 emergency and continuity of operations planning. If anyone has any feedback or comments. Not sure if you're off mute, Bethan, but we can't hear you.
Oh, I was waiting for you to call on me.
Oh, sorry.
I didn't know if you were distracted by something on the side. Just once again, I raised this earlier in the definition section. But again, we would suggest eliminating the word grievances and say complaints and formal complaints or something like that to better define what we're talking about and make sure it's not confused with other processes that are part of the labor, that are part of general labor law.
Thank you, Bethan. I don't see any more hands up, so we'll move into the following section, which is response and grievance in critical incidents 411-039-0090.
Oh, I thought that's where we were. I apologize. That's what I was referring to.
Okay, no problem. Thank you. We'll give it a few minutes. All right, we'll move into the following section, which is administrator qualifications and requirements 411-039-0100. If anyone has any feedback or comments.
We're on 100.
Yes.
I don't have my hand raised, but can I just go ahead and
Yeah.
speak? On sub 3, this language requires 24/7, 365-day coverage. And this type of mandate would dramatically increase the cost of service. We think that it would be appropriate to limit it to normal business hours or slightly expanded coverage. And it would capture the intent of the rule while preserving the financial resources of the state. There are types of emergencies that could only be handled by emergency personnel. And those would be the kinds of things that would typically fall outside of the normal workday anyway.
Thank you, Beth Ann. I don't see any more hands up, so we're going to move to the following section, which is direct support worker qualification and requirements 411-039-0110. Patty?
Hi, back to what was just discussed. Couldn't get my hand up fast enough.
No worries.
I believe this needs to be left intact because this population is not a 9 to 5 Monday through Friday job. And if there is some kind of critical incident or something that happens, the administrator's designee does need to be available. Somebody has to be answerable. So I would advocate for that to remain intact. Thank you.
Thank you, Patty. Rachel?
I agree with what Patty's saying. And then I just had comments on the section we were moving to, if we're ready to move to that.
Yes.
So I think it's under 2, in this section. Oh, that's weird. Sorry. My computer's like, don't you want to lower your hand? We see you're talking now. So it talks about needing to ensure that workers whose provider number has been terminated. And so I just want to make sure that we're clear about this, because my understanding is there could be different reasons for why a provider number is terminated, and I think some of this is just seeking clarity around that. So I want to make sure the intention of the language is that this is when a provider number is terminated for cause, like only for a substantiated allegation, that it's not when a worker just doesn't complete their initial mandatory training or their continuing education or something, or when they haven't worked, in a year and the provider number and I forget exactly what happens. I know there's experts on this call, but the provider number, I don't know if it gets terminated or if it just kind of moves away, but those kinds of terms will matter. So the core point is ensuring that a provider can still apply and work for an agency with choice if the only thing that's happened to them is like they missed the training that they needed to do, or they just didn't end up working, if that makes sense.
It does. Thank you, Rachel. I don't see any more hands up, so we'll move towards the following section, which is direct. Oh,
I had one other thing on that section too.
Okay, no problem.
In number 3, they also talk about, or you all talk about, that DSWs have to receive all the required training and additional training necessary to make sure they can competently provide the level of services that are going to be assigned, etc. I'm unclear why that's in there, especially with number 5, where 5 outlines that the administrator or their designee must make sure that the workers have the skills and ability to meet the individual's needs and honor the individual's preferences. So it feels duplicative at best.
Yeah. Number 3, just really quick, number 3 is just to ensure that, example, if there needs to be an additional training on like trach or other care, right, that might be available, but it's not part of the training that they've had. We want to make sure that that gets provided or anything like that. So we just that's the intent to number 3 and the other one. But thank you, Rachel. Beth Ann?
We would also comment that on number 5, that this seems to conflate the role of an agency with choice agency. Agency with choice is obligated to perform mandatory trainings. However, how the individual prefers to have their meals cooked, be bathed, or similar preferences, it's the individual's duty to train and not the agency with choice.
Thank you, Beth Ann. I don't see any more hands up, so we'll move into the direct support worker training requirements 411-039-0120 if anyone has any comments or feedback. Rachel?
Yeah, so we just wanted to make a note around the competency evaluation. So the agency with choice rules specify that the competency evaluation has to include direct observation and written or oral testing, but the current training for workers does not include direct observations as a requirement. So we think that should be omitted. And then there's also language in here that the agency has to submit pre-approved training plan that would mirror the OHCC standards, and training that would be tailored in self-direction, which is great. But right now, in-home care agency rules don't require pre-approval for that training. It's agency determined, but kind of outlines what topics it can cover. So, I mean, I think everyone is probably under the same impression that the training that the agency with choice is going to do is going to be in the topics that are outlined in these rules. But I think the issue is around where the pre-approval comes into play and some of the administrative burdens around that, especially if the in-home care agency is allowed to essentially just say, hey, we think this is good, like we approve.
Thank you, Rachel. Eugenia?
So I think there's it may be slightly different, Rachel. On the in-home care agency side, there are qualified individuals, qualified trainers, and there are programs that are kind of approved by OHA. And then there's also a separate, like, even if the in-home care agency is doing their own training, they've got to make sure that trainer is qualified and that they get those plans and everything reviewed. It's a part of the survey process. So I don't know if it's a different, you're right, it's a slightly different tone, but there are concepts around a qualified individual who can provide that training, qualified trainers, and qualified entities.
That
Thank
makes
you,
total
Eugenia.
sense.
I don't see any more hands up, so we'll move towards the following section, which is personal records 411-039-10130. All right, I don't see any hands up, so we'll move towards the following section, individual choice to receive agency with choice services 411-039-0140. Tina?
Sorry, you go too fast for me. It's not your fault. Under personnel records, I guess I spent so many months looking at the very first set of OARs and worked so hard on those that some things keep popping into my mind that were in those that were very good protocol. And I think they also spoke more than some other things too, that there's might be a little bit person-centered and consumer-driven. And one of them is, I think that there needs to be a requirement. I mean, it looks like you're putting some requirements that must be in every direct, support service workers file. And I think that an annual performance evaluation should be required as part of their record, because I believe that mandating an individual's evaluation, meaning their employer, their co-employer, has every right to give an evaluation on their view of their performance every year. And I don't see a vehicle for doing that if it's not mandated. Thanks.
Tina, can I ask you a question?
Sure.
I'm sorry, Allison Lee, I completely agree with you in terms of the managing employer evaluating direct service, but in the event that the managing employer didn't complete that, would it be punitive?
Um,
Like,
you mean if they didn't do an annual evaluation?
yeah,
Um, I don't know. I'm telling you, as an agency that would be looking at licensure, I
Mhm.
would say I'm not so sure I have a lot of confidence in how thoroughly you're evaluating your employees. I would think twice about that. Whether
Well,
there would be punitive, I don't think so. I think it would
and
just be something brought up.
I think my question really drives back to the managing employer, the managing employer being the client or authorized representative, actually conducting that and and feeling that there is some barriers to um, thoroughly getting evaluations, not that they don't occur on the floor, but that CDE or otherwise may not get access to that type of evaluation. And so you're really looking at the managing employer being the client or the individual receiving services or their authorized representative doing that evaluation.
Um, okay, are you saying that would it be would there be punitive action if you didn't include the co-employer? I'm
I think I'm
sorry, I'm
actually
being a little
suggesting that
dense.
no, not at all. I'm actually suggesting that the only person really qualified to do an evaluation outside of attendance is the managing employer.
Well, I think so too. I mean, I think the
Oh,
individual
okay.
that you're working for is
Right.
the person who can evaluate what you're doing. I
Yeah.
also think, however, as it describes the agency with choice and their role, I mean, there's probably some things that they would or wouldn't notice about an employee that they'd want to put in an evaluation too. I mean, I think if everything else is co this and co that, that would be fine with me, but I really think that there ought to be an opportunity um on an annual or at least, if you're going to be late, okay, 18 months, but evaluation of their performance on a daily basis. And I actually, that might be that someone from an agency with choice would actually meet with the I don't want to call them client, with the person getting services and fill it out together without the direct services worker helping them fill it out. Because I don't think
Mhm.
that's a great idea. Just like I think a lot of things aren't really the direct, support workers' role to do because not just of a perceived, but an actual conflict of interest. You don't do your own hiring. You don't interview yourself. You don't evaluate yourself. But I just think, we had before something about an evaluation in there. And I liked it only because we could make sure that the individual had an opportunity to express their views about their performance.
I
Thank you, Tina.
yeah, I don't
Uh,
disagree. Thanks, Tina.
Thank you.
and just wanted to make sure if we can just raise our hands. That way we have 10 more sections just to make sure that we give time for everyone and we are able to get through all sections today. But thank you. Rachel?
Yeah, I wanted to respond to Tina just to say out loud, and I think Allison captured this a little bit. Like, I think we all would like a very robust quality assurance process, and these rules are being written to reflect the bill that was passed, and we need to follow legislative intent on that bill. And that bill was not intended to get into the weeds like that. And in terms of like, how is the agency with choice going to perform that I'm not speaking well, but like there is a quality assurance embedded in these rules that allow the agency to have autonomy in how they do that to be able to meet the needs, those individual needs of that consumer, because it's that co-employment model rather than these rules being super prescriptive. And there's lots of reasons for that. And I think while Tina, your idea is a good one, it's something that I don't think belongs here, but is maybe an idea that we could build on in the future. For like future iterations of this. And then I wanted to move us along to the 0140 for the individual choice section for receiving agency with choice services. In one there, it talks about at the request of the individual for agency with choice services. And I believe that language needs to be modified to further strengthen the choice counseling that would be involved. So for instance, when I read this, to me, this sounds like if an individual goes in and asks for agency with choice services, then that's going to be honored and respected. I think what it needs to refer to is that the case manager engages in robust choice counseling, and that choice counseling, once completed, if the individual then indicates that they want agency with choice services, then that case manager is going to follow up on that. But it's not the onus should not be put on the individual to request it. The onus should be put on the case management entity to engage in robust choice counseling that would include agency with choice in that.
Thank you, Rachel. Any other comments or feedback on this section? If not, we can move forward to individual records 411-039-0150. All right. Oh, Beth Ann.
Thanks. We would rewrite sub 7 in this section. As currently written, the language does not accurately reflect the size, scope, and operational structure of the entities that are likely to want to be licensed and contracted as agencies with choice. We are going to offer some revised language that more appropriately accounts for the organizational realities of the agencies expected to bid on this project, and that we suspect you are hoping will enter into a contractual agreement. And the way we would rewrite it is if there is a change in the business entity operating as an agency with choice, all individuals' records must remain with the agency with choice until a new licensee has assumed control of the individual's records. It is the responsibility of the outgoing licensee to protect and maintain these records. This requirement applies when the underlying business entity changes, regardless of whether there is a change of ownership. And that will come through in a written comment too.
Thank you, Beth Ann. All right, I don't see any more hands up, so we'll go into individual rights, which is section 411-039-0160. Right, we'll go into the following section, which is delivery of services 411-039-0170. Beth Ann.
We're wondering on, this is 170, right? 0170. That's where we are.
Yes.
Okay, just confirming. We're wondering in a number of these just how things will be billed. For example, in sub 2, we're wondering how tasking will be billed. Sub C refers to specifying the tasks to be conducted. What are the assumptions on denials of that type of billing? And then in sub 4, how is overtime managed, approved, billed, or reimbursed by the department? I don't expect you have to answer that, but it feels like there should be some sort of direction in these rules. And then I think you have it as sub 5, under the agency with choice model of self-direction, the individual or the authorized representative should inform the direct support worker. In this type of scenario, it is typically the direct support worker who routinely engages with the individual and is the first to identify any change in condition. And then in sub 7, routine drop shifts by a direct service worker should not be required to be reported by the agency with choice. To do so undercuts the purpose and pricing of the agency with choice model. We appreciate that there are instances such as emergency situations, FMLA, and other paid leave benefits that require communication.
Thank you, Beth Ann. I don't see any more hands up, so we'll move into the initial visit and monitoring for 110390180. Moving along, quality assurance and performance improvement for 110390190. Beth Ann?
In 1 sub A, it says issues with infection control. And we think that that phrase suggests that it's more related to a traditional agency program. Services that are provided in individual homes and services that are directed by the individual or authorized representative. Frequent home inspections is clearly outside the purview of an agency with choice model of care. And as a result, the agency with choice agency may be able to train on infection control, but mandating additional requirements will, again, have cost increases that may not be appropriate for this program in the budget that was approved for it.
Thank you. I don't see any more hands up, so we'll move towards the following section, program review and investigations for 110390200. Beth Ann?
So this is where we become concerned about some of the timing that's assumed in these rules. We've got 3 points in regard to sub 1. A license is good for 2 years to promote stability and continuity and increase the strength of those entities applying for a licensure and going through the RFP process. We think that the license term should be more like 5 years. Also, in 0390030, license renewal actions require a 60-day notice. If a review as mandated by 039200 finds issues, then a compliance review must be conducted and completed at least 150 days before the license renewal to accommodate the 90 days mandated by sub 2 in this section. And ultimately, the license term and actions are very tight, and it's unclear how you could ensure due process, dispute resolution, and we hope that there will be further review of the timelines and currying how they work together and interplay to ensure continuity of service for the individual, as well as creating viability for the agencies that are going to be probably not from Oregon and working in multiple states, making sure that they're in alignment with what's realistic from a business perspective.
Thank you, Beth Ann. I don't see any more hands up, so we'll move down to the following section, which is complaints for 110390210. Tina?
Just on the last conversation, and I hope people can take this how it's meant, but I've never believed that you write administrative rules for the convenience of who might apply to do it, whether it's in their business structure or convenient for them or whatever. I believe that the state needs to do what's in the best interest of the individuals and the state money that's being given to these agencies if they want to do the service, and the state needs to see them at this frequency before they apply. They can decide if they can meet those standards. I just am I've heard that about 4 times now, where it feels like we're writing these to meet the standards already in place by somebody that everybody knows, thank goodness, except me, that's going to apply for to be the agency of choice. And I think that's extremely contrary to the department's obligations.
Thank you,
Can I
Tina.
May I
Bethan?
respond to that? Thank you, Andrea. Tina, I appreciate what you're saying. I think that our comments about the timing have to do with the significant amount of money that's required to be invested to get a program up and running, and the time it takes to develop the systems and put those in place. It also reflects experience in other states for similarly situated programs. And while my client is very interested in this program, there are not that many companies that will, have the infrastructures in place already. So this is just comments that we think that will ensure smoother business practices. We absolutely agree that safety and care for both the direct service workers and the individuals is of primary value. But the business end of this does matter. And we're providing these comments in that context.
Thank you both. I don't see any hands up for the complaint section, so we're going to move along to abuse and reporting and investigation to 411-039-0220. We'll move right along to enforcement 411-039-0230. Rachel?
I just wanted to, I guess, just express my support for some of the stuff that Beth Ann has been lifting up around the timelines. When I was reading through this as well, and this isn't the only section, but I was reading my notes in this section, and 10 business days this, 30 business days that, like throughout the rules, there's a lot of that. I think Beth Ann reflected some concerns over the crossover and the overlap of that. And so without like doing a deep dive analysis on my end of like I'd almost have to do a visual, of like, oh, if this then that, and if this then that. But I just wanted to say out loud that I also, when I was reading it, was like, do these timelines work? Like, if you really break it down, how problematic and how challenging is this going to be? And I don't know how much that relates to this 10 business days thing, but I just wanted to raise it because nobody else was raising their hand, so I thought I would just use that as a way to say that I think doing a deeper analysis on whether the timelines make sense in relation to each other throughout the rules would be really helpful.
Thank you, Rachel. Beth Ann?
Thank you, Rachel. And in sub 5, we just wanted to raise the issue that each of these actions are a civil penalty, and the 10-day and 30-day timelines above are all inconsistent with the rights prescribed in ORS 183-745 and the Oregon Civil Penalty Procedures.
Thank you, Beth Ann. I don't see any more hands up, so we'll move towards the next section, which is civil penalties 411-039-0240. Beth Ann?
Me again. In sub 2, we just want to make sure, we want to confirm that this does not assume personal liability for the administrator or designee.
It's for the agency with choice, just the license, um the business. Sorry, I was gonna have a coughing spell here. But thank you for that question, Beth Ann. I don't see any other questions, so we'll move towards the conditions section, which is 411-039-0250.
Sorry, on the, can I go backwards for a second? On the civil penalties, section 1, there's no definition of final rule. Or final order, pardon me. And just pointing out that the applicable laws and rules are defined, but a final order is not.
Thank you. If there's any other comments or feedback in the section condition 411-039-0250. Beth Ann?
In sub 2, each agency with choice agency will have a contract that stipulates the service to be provided in exchange for remuneration. This section contemplates items that may not be listed, which in turn results in cost drivers. The department adding material terms to an agreement by operation of administrative rule could be problematic. This might be a section better suited for contracts.
Thank you, Beth Ann. I don't see any more hands up, so we'll move towards the denial, suspension, or revocation of license 411-039-0260. I don't see any hands up, so we'll move towards our last section, which is financial transparency and reporting requirements 411-039-0270. Rachel?
I think this section looks really good on the whole. I just wanted to underscore, I do think there's benefits in adding language to specify what comes under the admin rate, to include things like I don't know, like employer taxes or background check costs or workers' comp or things like that. I don't know how detailed we need to be in the rule because I think it does allow for that extra in there. I think, we wanted to make sure that there's enough in there to support substitute staffing, costs associated to that. So as long as we feel like it's broad enough to make it reasonable in terms of what would go under the admin rate, that makes a lot of sense to us. And the 85% for labor is excellent.
Thank you, Rachel. All right, everyone, we truly appreciate the commitment. I know that this is the fifth, I believe the fifth RAC or more, but we just want to appreciate your guys's feedback and comments that we have received throughout this entire process. Thank you for your patience. I know it hasn't been easy in regards to like just getting all that information to us as well. So we really do want to appreciate each and every one of you guys who provided feedback or comments during all of our racks. I think that has really has been definitely helpful for us. And we also want to apologize as well for the long timing of this, but we were working through, it was a bit over 500 comments. And so that did take a little bit of a while to get it all sorted out, but we just want to let you know and inform you that we do look at each and every single comment that we received throughout the entire process. And we do hear you guys out. So just we appreciate you guys all, and thank you for coming to our last and final rack. And
Andrea,
yes.
oh, sorry, I was hoping that you might be able to provide participants with kind of expected next steps.
So and thank you for that, because I wanted to also mention that we hope to receive, and the deadline for providing feedback and comments would be end of day on Monday, the 16th. So next Monday. So we're able to work through them within the week. I'm hoping to be able to respond to all you guys with just a brief summary of with your guys' feedback. After that, Jason, please pop in. Our next step is to either modify language, look at your guys' key comments, submit to be able to go into a hearing. That would be our next step. And during our hearing, you guys will also have an opportunity to provide comments and feedback to the final rack, or the final OERs are going to be posted to the Secretary of State. So that is the next step, and we'll keep you guys posted in regards to that. Rachel?
Thanks, Andrea. Do you have any dates, anticipated dates? I mean, comments are due by the 16th. How long is it going to take you to review? When do you anticipate the hearing being posted? When do you expect final rules?
So the comments, depending, right? Because right now it's just we're estimating. We're not sure how many comments. We know that Beth Ann, yourself, Rachel, and maybe other individuals that will send us comments, depending on how many comments received. We want to make sure we look at each and every one of them. My estimation, and this is just an estimation, we should probably have them reviewed by not the end of the following week. It might be a bit the beginning of the week after. And then that's when we would be able to have some sort of timeline in regards to does it look going into the hearing and being able to submit it to the state, the Secretary of State. If we receive less comments, just depending, then we might be able to get it completed by the end of next week. It all just depends on the feedback and comments that we received.
So 1 to 2 weeks, we're hoping maybe no later than early July to have clarity on those.
Correct. And we're going to try to move forward fast. But again, we want to make sure that we read and go through each and every single comment to make sure that your voice is being heard. But yes, that is the estimation.
Appreciate the clarity. Thank you.
Mm-hmm. And please feel free to email us if you guys do have any questions or want information on any particular section. We did put in our generic email in the chat, but we can definitely do that again. That way you guys know where to reach us. And once again, we appreciate you all, and thank you for coming, and happy Thursday. And I will stop recording now.
Thank you very much, Andrea, and thank you to everyone who's able to join us today. Just want to reiterate that